This video is brought to you by Group 5, composed of Zion, Maria, Raj, Jiangyu, and I, Haodong. In this video, we are going to talk about the thyroid glands.
First, we're gonna talk about the anatomy of the thyroid gland. Thyroid is the largest endocrine gland. It's shaped like a butterfly that's located at the front of the neck, anterior to the larynx, and just below the Adam's apple. It consists of two lateral lobes connected by a medial region called isthmus. Some individuals have third lobe called pyramidal lobe. Thyroid has two kinds of nerves: parasympathetic arising from superior and recurrent laryngeal nerves, and sympathetic arising from superior, middle, and inferior cervical ganglia. For the blood supply, thyroid has two main arteries. The first one is superior, which is for supplying the superior and anterior portion of the gland, and inferior thyroid artery, which is to supplying the posterior inferior portion of the gland.
So my part is the embryology of the thyroid gland. The blastula is formed after fertilization. There are three layers, which is the ectoderm, mesoderm, and endoderm. The notochord is also formed, and then as you can see, there are two neural crest which later will fuse to form the neural tube, and then this takes place during the third week of the development. So from week 4 to week 5, the pharyngeal arches 1, 2, 3, and 4 are formed. From the coronal plane, you can see that there is the thyroid diverticulum formed. And at the sagittal plane, this thyroid diverticulum is located at pharyngeal arch 1 and 2 at the foramen cecum. So on the adult body, you can see that this thing moves from the foramen cecum to the hyoid bone and to the trachea to form the thyroid gland. Now we move to the
The cerebral gland is unusual in that the hormones are stored in cavities, surrounded by secretory cells, which make up a follicle. To secrete the hormone is reabsorbed from the cavity and then released into the surrounding interstitial spaces. The stored hormone is bound to glycoprotein, and this stored hormone is called colloid. The colloid consists mostly of seroglobulin and serohormones that are bound to the colloid. Parafollicular cells lie between serofollicles. Cerebral gland synthesizes hormone from tyrosine and iodine. Colloid is the center of cerebral hormone production. It produces two types of hormones: the iodine-containing hormones T3, T4, and calcitonin. T3 and T4 are secreted by follicle cells. Calcitonin is secreted by parafollicular cells. The pericerebral gland is embedded in the capsule of the cerebral gland. It contains two types of cells: Schiff cells and ossifil cells. The Schiff cells are small and pale eosinophilic staining. They secrete pericerebral hormone.
Thyroid hormones are secreted from the thyroid follicle cells and are synthesized from tyrosine and iodide. The thyroid hormone synthesis is regulated by the TRH from the hypothalamus. When the blood thyroxine level or the metabolic rate is low, the TRH triggers the TSH from the anterior pituitary gland. The TSH released into the blood stimulates the follicle cells of the thyroid glands to secrete thyroxine hormone into the blood. The levels of TRH, TSH, and thyroxine hormones are regulated by the negative feedback system. When the blood thyroxine concentration is high, the secretion of TRH is reduced. Few examples of thyroid hormone functions include increasing basal metabolic rate, induction of lipid and carbohydrate metabolism, and many more. Other than the thyroid hormones, there are two hormones which plays an important role for calcium homeostasis: parathyroid hormone and calcitonin, which has an opposing effect of each other. Parathyroid hormones secreted by the Schiff cells increases the blood calcium level. It binds to the receptors on bones to stimulate osteoclasts, as well as onto the kidney cells to increase calcium uptake in kidneys. On the other hand, calcitonin produced by the parafollicular cells are secreted when the blood calcium level is high. It binds to the receptors on the bones to stimulate osteoblasts to increase bone deposition, and on the kidney cells to reduce calcium uptake in kidneys.
Now we move to the diseases of the thyroid. Hashimoto's disease is the most common one. It's an autoimmune disease causing fatigue and sluggishness, increased sensitivity to cold, constipation, pale eye screen, and the treatment is synthetic hormones. Graves' disease is the second most common one. It is an immune disorder that causes hypothyroidism, which gives rise to anxiety and irritability, fine tremors, heat sensitivity, increased perspiration, moist skin, weight loss despite normal eating habits, and also goiter. Treatment includes radioactive iodine therapy. Now, my
Common thyroid disorder includes the goiter. The goiter is a condition when the thyroid enlarges but it is not cancerous. Most often, it's caused by iodine deficiency, but it can be associated with other thyroidisms such as Graves' disease. Patients generally experience swelling or tightness in the neck, difficulty breathing or swallowing, coughing or wheezing, or just a general hoarseness of voice. All in all, when presented alone and in the early stages, with introduction of iodine-rich diet ought to reverse this condition. In conclusion, we hope through this video everyone can appreciate a little more about our own bodies. Without a functional thyroid, it is almost impossible to sustain a normal and healthy life. Thank you all and stay safe.